In this video, we're going to talk about state versus federal minimum wage. So it's important to know that the law and the federal law actually establishes a minimum wage of $7.25 an hour. Now, within that, 23 of the states in the United States follow the federal minimum wage. So for example, I live in the state of Louisiana. Our minimum wage is $7.25 an hour. That doesn't mean every employer that's around here pays $7.25 an hour, but they have to, at a bare minimum, pay $7.25 an hour. Now, just like we said, only 23 states have adopted that. There's also something called a state minimum wage. So 27 states have actually adopted a wage higher than $7.25 an hour. A perfect example would be the state of California. As of 12/4/2023, which is of course today's date, they have a minimum wage of $15.50. And so far, they haven't slowed down. Every year, they tend to go through a cost of living adjustment or an increase in minimum wage. But it's important to understand that there is a minimum wage for states as well. And again, the higher the two must be paid. So this is a pretty common situation, especially if you're a home health agency that's located in multiple states, especially bordering states. Sometimes you might go acquire new agencies and you might get more home healthcare companies that you acquire or merge with. Well, the bigger your company gets, the more you'll run into this situation where a person may live in one state but work in another. So while we're not talking about taxation, taxation has different rules and regulations and laws, and that could be a total separate course. But you're probably going to ask the question, well, what if I have a person that lives in one state but works in another? Which wage am I paying them? Well, just keep it this way. If the employee lives in Louisiana and works in Arkansas, which wage do you pay? Well, you're going to pay the wage where the employee physically works. It doesn't matter where the person lives. For taxation purposes, maybe taxation, but in terms of compensation and wages, you're actually going to pay the wage where the employee works. So if they work in the state of Arkansas, you pay the minimum wage for Arkansas. You don't pay the minimum wage for Louisiana. So why do you need to know the minimum wage? Well, it seems pretty trivial, and for some of you that are watching this, you might never have this issue ever in your career and may have never come across it because you're very well aware of it. But if you're one of those folks who have never touched this and never had this sort of education, you may not know. It seems pretty small, but 2 of the 20 cases that were reported from the home healthcare agencies that violated these rules that were advertised this year, basically they did not pay the appropriate minimum wage to their home healthcare workers. And I just want to be transparent with you that out of those that I've tracked, the 2 that were there, they paid over $641,000 in back wages that were recovered. Plus, they had to pay an additional $641,000 in liquidated damages. So imagine if you discovered this and the Department of Labor came in and said, well, you owe $300,000 in back wages, but because we found this and your employees came to us to report this, you owe an additional $300,000. Could you imagine that? So $1.2 million in total wages recovered. So yes, you absolutely need to know this. It's super crucial.